Hi everybody, Dr. Cary Yurkiw here. Today we're going over the Tereś Minor muscle. And recently a few patients have had issues with the Tereś Minor. I'm going to show you what the Tereś Minor muscle is. It's part of the rotator cuff, as well as some good exercise for it. So let's just first take a look at the definition of what the rotator cuff and Tereś Minor is. So as a rotator cuff muscle, the Tereś Minor stabilizes the ball and socket glenohumeral joint by helping hold the humeral head, the ball, into the shallow glenoid cavity of the scapula, the socket. The Tereś Minor also laterally or externally rotates the arm at the shoulder joint. So it lifts the arm up sideways and turns the palm outwards. So that's kind of how that works. And what I'm going to do now is just bring over the Tereś Minor muscle. So you can see that one right here in green. And this is part of the rotator cuff, supraspinatus, probably the most commonly injured muscle in the rotator cuff. Then you've got the infraspinatus right here, this large group, Tereś Minor and Tereś Major. So Tereś Minor is a smaller muscle. It's kind of like right behind the shoulder, and kind of, if you dig in a bit underneath the deltoid, that's where the Tereś Minor is. So it's not the most commonly affected muscle, but I have had a couple patients recently with that Tereś Minor issue. Because it does the external rotation and the lateral movement, we want to work some exercises that are going to focus on that area. So I like the wall angels. I generally give that to people that have shoulder issues. So just like snow angels, you stand against the wall, you have your elbows bent like this, and then you just reach up overhead, keeping your elbows against the wall as you slide your arms up and down the wall. So for this exercise, you'll have 5 points of contact with the wall. Position yourself with your buttock, the mid-back, head, elbows, and hands against the wall. While maintaining these 5 points of contact, slide your hands up the wall. Don't let your head leave the wall. And if you have any pain in your low back, try moving your feet further away from the wall to take stress off your low back. This exercise is great for posture. Perform 3 sets of 10 repetitions or 10 reps every 2 to 3 hours. Now, I wouldn't do it every 2 to 3 hours, but I generally give my patients 3 sets of 10 repetitions first thing in the morning once they get out of bed and kind of limbered up, and then 3 sets of 10 repetitions at the end of the day before bed. So that's a good way to start. Now, I like these prone, lying on your stomach, Ys and Ts. So lay face down on a bench with your arms relaxed towards the floor. If you don't have a bench, you can lie on the side of the bed and perform one arm at a time. With your palms facing the floor, squeeze your shoulder blades together and down until your arms make a Y overhead. Repeat this exercise with your arms making a T at shoulder height and perform 12 Ys and 12 Ts. You should feel the muscles in your middle back working. So this is good to stabilize the scapula, the shoulder blade, work the rhomboids, those are the muscles between the scapula and the spine, and help these stabilizers, which is really important. Now, an advanced exercise for this would be to, and I do this in the gym, where you lay face down. I take a very light weight and I pass it, kind of make a circle with one arm, pass it behind my back while I'm lying face down on the floor, and then grab the weight with the other arm and come around, making a 360-degree movement. Now, I wouldn't do that right away, but later on in your treatment plan, talk to your health care professional. And if you're coming to the clinic, then what I can do is get you to progress from these prone Ys and Ts to very easily doing a light weight and doing a circular movement one way and then a circular movement the other way, just to strengthen those muscles. So this is going to work to stabilize, but then we want to work to strengthen. The other one that I do like is these external rotation right here, cable pulls. So if you can get an elastic band, you could do this at home. If you're at the gym, they usually have these cable machines where you can set the plates with a certain amount of weight. I would start really light and then keep your elbow close to your body and then you're going to rotate the cable outward. So place a towel underneath your elbow. That's what they have for a spacer right there. Against your side, and with your elbow pinned at your side and bent to 90 degrees, pull the band across your body, starting near the belly button and moving away from your body. Throughout the motion, keep your elbow pinned at your side and your shoulder blade pinned down and back. So you want to stabilize the shoulder blade. It should be down and back and secure. Do not roll the shoulder forward. Perform 3 sets of 15 repetitions. I would say with a lighter weight, maybe 1 or 2 plates, that would be a good start. And you could do, I would say, 3 sets of 15 repetitions would be fine. I would do both arms because you want to make sure the shoulders are balanced. And if you did those 3, the wall angels, you did the prone Ys and Ts, and you did the external rotation, that would be a really good way to strengthen the rotator cuff, in particular the teres minor. So this is a very good exercise. If you guys have any questions, please let me know when you come in the clinic. If you're not a patient of mine, you can always message me here and leave a comment. I'll get back to you, or I'll leave a link where you could set up an initial consultation. I'd be happy to talk to you about your concerns and then refer you to a chiropractor in your area that can follow through with the treatment.